Hi everyone, and welcome back to my channel, The Business of Medicine. Today we're going to be talking about an exciting topic, which is starting your own GP practice. This is the topic that I've heard most often from colleagues, is that in med school and undergraduate training we just don't get taught about the business side of medicine. So today we're going to look at starting your own practice, registering the business, getting a practice number, and working with medical aids and labs. So let's get started. The first step is to register your business with the Companies and Intellectual Property Commission, the CIPC. This will make your business a legal entity. You'll be required to have a business name and to complete the relevant registration forms. So once your business is registered, you'll need to get a practice number. A practice number is essential for billing medical aids, as well as billing other healthcare funders like pharmacies. In order to get a practice number, you'll need to do it through the Practice Code Numbering System, which is through the Board of Healthcare Funders, the BHF. You can visit the website below. So for the application process, you will just need to prove that your HPCSA fees are up to date. You'll also have to pay a small application fee and complete the relevant registration forms. So now let's talk about taxation. As a business owner, you will need to register for a tax number through the South African Revenue Service, or SARS. This will enable you to operate your business legally and make sure that you follow all tax regulations. You'll be responsible for ensuring that you pay income tax on the profits gained by your business. The next important thing is to register with medical aids. South Africa has many medical aid schemes, and collaborating with them ensures that you can provide a service to their members. You can contact the medical aids directly and complete the registration forms. The same goes with labs like Pathcare and Ampath. They contribute significantly to your healthcare system. You can contact the labs directly and complete the registration process. The next important thing to look at is insurance. So there are 4 different types of insurance that I'll be discussing. The first one, and the most important, is professional liability insurance. This is to protect you from a lawsuit should someone sue you for malpractice. The next one is product liability insurance. So this is if someone comes to harm due to your equipment or medication that you supply. The third one is public liability insurance. This is if someone harms themselves by falling or injuring themselves in your practice. And the last one is building and contents insurance. This is to protect you if there is any theft or damage due to natural disaster of your building or contents. There are more insurances that you can research, but these ones cover the essential parts of your practice. The malpractice insurance and the building and contents insurance are the most important to protect you against potential damage or lawsuit. So next we're going to talk about the vision of your project. So the business plan should include what your goals are for this business, what the target market is, what services you want to render, and what your marketing strategy is. Included in the business plan should be your startup costs. These are the costs that involved in getting your business going. Things like money for rental or purchase of the property, any renovations that will be needed to make it fit for purpose, equipment like medical equipment, IT, hardware and software, and any communications infrastructure. Also included in the business plan needs to be the source of your funding for at least 6 to 12 months to cover your expenses until your business is up and running and in a self-funding position. Next, we're going to discuss the topic that I find the most complicated, which is billing. So with billing, you need to do good market research. You need to see what demographic of the area that you're opening up your practice, what your projected number of patients you'll be seeing per day, per week, or per month, whether you'll be working directly through medical aids or whether you'd be charging the patients on the day and they can claim back for medical aids afterwards. These kind of things determine what rate you can charge. You need to make sure that you have your fixed monthly expenses covered, which includes rental, municipal costs and salaries. So now let's talk about the premises of where you're going to set up your business. So you need to locate an area, whether you're going to purchase it or rent, and then set it up fit for purpose. So you'll need a consultation room, an exam room, potentially a treatment room, a waiting area and an administration area. You can also decide on what decor that you want to use. Choose colors that will be soothing, music that you might want to play in the background, and also any magazines or entertainment that the patients can use while they wait. This is also potentially a good time for health promotion and health education. So next you need to consider recruiting staff, such as a receptionist. The receptionist can also double as the admin or billing clerk. You need to consider whether you need medical assistants or nurses, or potentially have more rooms where other doctors can join your practice. So now that you're all set up, it's time to advertise your business. You can do this through social media, to starting a website, or through flyers. Another thing is to set up a referral system where other doctors or specialists can refer to you, and where you can refer to specialists or hospitals should your patients need further care. Other startup considerations are business cards, printed logos, letterheads, script pads, and appointment cards. One of the most important aspects of managing your GP practice is to maintain financial records and keep patient records. This ensures that you are compliant to all regulation requirements and helps you manage your practice. For billing, you can do in-house billing or outsource to an external company. Starting a GP practice in South Africa takes careful planning and market research. It can seem overwhelming at first, but with clear guidance and persistence, you can create a successful practice that makes a difference in patients' lives. So that's it for today's video on starting a GP practice. If you found this video informative, please like and subscribe. See you at the next video.